Thank you, Mr. Williams, and a pleasant good evening to all listening. This evening, I present the Health Emergency Operating Committee's Situation Report for Wednesday, July 28th, 2021. The response to the COVID-19 pandemic continues to be robust here in the Federation of St. Kitts and Nevis. During the period May 19th to July 27th, we have seen an increase of 537 confirmed cases, of which 492 persons have recovered. There are currently 42 active cases, with 2 hospitalizations and 3 COVID-19 related deaths. The graphs shown indicate that we saw our highest number of cases in this current wave during the period June 6th to June 24th. Additionally, owing to the work of the contact tracing team, we are now seeing a flattening of this curve. Therefore, to summarize our current situation, the Federation has a total of 582 confirmed cases of COVID-19, with 562 cases in St. Kitts and 20 cases in Nevis. 537 cases have fully recovered, and we now have 42 active cases, 2 hospitalizations, and 3 COVID-19 related deaths. We continue to monitor the situation in the prison. To date, a total of 56 inmates have been impacted, of which 55 have fully recovered, leaving only 1 active case in the inmate population. The prison staff has also been affected, with 18 confirmed cases, 14 of whom have since recovered. There are 4 active cases among the prison staff. In response to the outbreak in the prison, a training session was held on July 9th to build the COVID-19 response capacity in the prison system. Our contact tracing efforts continue. 2,701 persons have been interviewed and placed in self-quarantine. 2,539 persons have since been released from quarantine, while 162 persons remain in quarantine. During the period May 19th to present, approximately 15,668 samples have been processed here in the Federation. Our vaccine program continues, and by the end of day, Tuesday, July 27th, 71.8% of the target population had received their first dose, and 59.4% of the target population had received their second dose. Persons who would have received their first dose of the vaccine between June 3rd and 30th would have received a 12-week appointment. Since the recommended interval between doses is 1 month, 4 weeks, to 12 weeks, persons can return for their second dose once 4 weeks or more have elapsed since receiving their first dose. Please note that the current batch of vaccines will expire on August 30th. Additionally, based on the calculations, we have at least 9,320 adults left to be vaccinated to achieve our target population. New health and travel policies came into effect on June 12, 2021. Inbound passengers will now qualify for a reduced quarantine period of 3 days, with the exit test sample taken on day 4. Once a negative RT-PCR result is received from the laboratory, the traveler will be released from quarantine. An important note, if day 4 falls on a Sunday, The sample will not be processed until Monday. The RT-PCR test results can be expected within 12 to 48 hours. For persons leaving quarantine, the certificate of release from quarantine isolation will be issued by the Chief Medical Officer. This certificate can then be attached to the Social Security sick leave form and submitted. Please note that Section A of the Social Security form must be completed by the insured or the employee, while Section C must be completed by the employer. The CMO's letter will suffice for Section B of the form. Living with COVID-19 requires adherence to the COVID-19 protective measures and behaviors, which includes wearing a face mask appropriately covering both nose and mouth, sanitizing your hands with soap and water or an alcohol-based sanitizer, maintaining a safe distance of 6 feet or more from persons with whom you interact, or staying at home when ill or when ordered to do so. Another important measure against this virus is to be vaccinated. Finally, our 311 operators have been responding to a number of calls, and we just want to take this opportunity to share with you their responsibilities. Number one, to assist persons who are experiencing respiratory tract symptoms, to address callers with issues to individuals within quarantine or isolation, to address any questions related to general health systems operations, to document the side effects of the vaccine, to refer callers to psychosocial needs and concerns. And please note that our 311 operators do not provide COVID-19 test results. Additionally, they link callers to allied support officials, including our police, our contact tracing team, and even our social services. And finally, they do document the requests for letters for persons who will be leaving quarantine or isolation. Let us all work together to reduce the impact of this disease. Stay safe, stay healthy. I thank you.